This is a video message from the medical staff supporting the UK Invictus team for the Toronto 2017 Games. This simple advice will help to make sure that you arrive in the best possible condition for the event. Firstly, when thinking about packing, please make sure that you bring all your medication you will require and any dressings that you regularly use. It is not always possible to get exactly the same types in other countries, so pack enough for the duration of the trip. But please do not put all of these into your checked-in luggage, but put some into your carry-on bag in case your luggage ends up in Timbuktu rather than in Toronto. That way you will still have some to tide you over on arrival until more supplies can be found. The next consideration in your preparation is prevention of deep vein thrombosis. Our experience travelling with Paralympic teams has shown this has been a real issue from long-haul travel, and there are some steps that you can take to help to prevent this. Purchase some flight socks, also known as compression hose, from a pharmacy. These not only reduce the chance of DVT, but also reduce swelling in the ankles from travelling. These are quite tight-fitting, and we recommend putting these on before you leave home rather than trying to do it in the cramped space of the aircraft. Arrive at the airport in good time, making sure that you have all your medications, equipment, and don't forget your passport. Boarding the aircraft with a large team with a variety of mobility impairments is going to take some time, so do be patient and work with the ground staff to facilitate this. The flight from London to Toronto is going to take approximately 8 hours, so it's going to be a long and tiring day. We know that long periods of air travel in low humidity air will tend to lead to dehydration, which increases the risk of DVT, and this is made worse by alcoholic and caffeinated drinks. So please avoid these, but do drink plenty of water. However, some people will avoid drinking plenty of fluids as this might increase the need to use the toilet. If you have mobility issues or need to self-catheterize, for example, you might consider drinking less to avoid this. Please keep drinking as dehydration also increases the risk of developing urinary tract infections, which is one of the commonest problems facing people with spinal cord injury. The commonest illnesses in athletes traveling to and at games are upper respiratory tract infections and stomach upsets with diarrhea and vomiting. Traveling in close proximity to others is a common way of spreading infection. It's important to minimize the risk of spreading infection by good hand hygiene. The use of antiseptic gels is recommended, so please make sure you keep some with you at all times. In a team situation, it is essential not to spread your infection to other teammates, so in addition to taking preventive measures, please report any symptoms as soon as possible to the medical staff so we can try and avoid spreading it to the rest of the competitors. Staying comfortable in aircraft seating can be difficult, and some people prefer to remove their prosthesis. We have seen cases where the residual limb or stump becomes swollen during the flight, and then it becomes difficult to get the prosthesis on again without causing undue pressure on the skin. So if you do remove your prosthesis, it is probably best to keep the liner on or use a simple compression sock in place during the flight. Air travel is tiring, with long periods of hanging around airports before even getting on the flight. And with an 8-hour journey, it will make for a long day. In addition to travel fatigue, there is also jet lag to take into consideration. Toronto is 5 hours behind the UK time, and this will further add to the tiredness issues, and you can expect some disturbance of your sleep pattern for 3 to 4 days after the arrival. Try to avoid the use of screens or phones close to bedtime, and also if you wake during the night. Those competitors who do have problems with lack of skin sensation, it is really important to check the buttock area for any red marks or areas of skin breakdown after a long-haul flight. Pressure sores developing can be a major issue if not treated quickly, resulting in weeks of treatment. We have a fantastic medical team with plenty of Paralympic sports medicine experience who are here to help you. So if you need help or advice, then please just ask. If you're not 100% and in tip-top condition, then it will reduce your chance of winning medals. And when the competition is done, just remember that you need to repeat the same process on the way home. Jet lag traveling in an eastward direction is worse than traveling west, so expect to be feeling tired and out of sync for a few days after your return. Best wishes, good luck, and stay healthy.